I was invited as the chair of Euromelanoma Europe, and I was presenting all the campaign that we organize in all Europe. So it's a campaign which has been initiated in 1999 in Belgium, and since then many countries are joining us. We are more than 30 countries now joining this campaign. And every year I provide material for every country to organize locally a campaign with a communication kit, a website available for them, a press file, and they can organize locally their own campaign. The idea is really the awareness of skin cancer. Skin cancer can be seen. It's very important to raise the education and increase the education about skin cancer, because we know that when people are educated, they can recognize for themselves or their family, and it's important that they come very early. Early diagnosis is very important because we know that we save life if we do this early diagnosis. The campaign is based on different cancer, melanoma, but also the non-melanoma skin cancer. It's important that people recognize the signs. So the first things that we really emphasize is really to recognize all the signs related to that. Something that you see on your skin will change. For melanoma, you have different system to recognize it: A, B, C, D, E, asymmetry, irregular border, difference of color, large diameter. E for evolution, changing of the mole. It's important. Also to recognize their own risk. People have low risk of getting a skin cancer, but also they can be at a high risk. And this is important because they have to check themselves much more than the others, and to be checked also by specialists. We try to do that every year because we know that awareness is getting down if we don't do anything. And we have the help of the media, and film like this are important because the people like to look film and to understand what's happening. First, they have to recognize if they are at risk. If they have a fair skin, many moles, history of skin cancer in their family or themselves, they are at much higher risk. So if you look at yourself, it's important to look at yourself once a month and to learn how to look. That's all the kit of self-examination, and we have that information on the website that we organize, Euromelanoma. They can have a look, and even we made a film just to encourage people to look at themselves and how to look. Every year we try to find a new theme. We emphasize more on secondary prevention. Secondary prevention is more to how to recognize it. And this year we had this spider image. I don't know if you have seen it, but it's a spider, and this spider is something that you want to keep on your arm. So it's just to say why you let spots like this stay on your arm when you don't let this spider on your arm. And we develop all the idea of denial, which is something not studied at all in cancer. And it's amazing because as a clinician, we are used to see that. Regularly people coming with huge lesions, and you said, even if you don't know what it is, how can you not move to ask what it is? And this process is quite known by the clinician, but it was not really studied, and we developed a film with a psychologist to explain what it is, and also to decrease this reaction, because if people do understand that early diagnosis and the screening is really very easy and it's harmful, you are totally safe. So it's important to be diagnosed early.